My name is Cornelius James. I'm a general internist and a general pediatrician at the University of Michigan. The problem that my project is aiming to address is related to preparing clinicians for AI in their clinical practice. My prior work largely focused on preparing individual clinicians, more specifically physicians, to integrate AI into their clinical practice and to use it in their clinical reasoning. But as we know, healthcare should not occur in silos. It's actually a team sport that should include interprofessional healthcare teams that may involve nurses and pharmacists and physical therapists, and certainly the patient being at the center of those teams. So AI is being rapidly developed, rapidly deployed. Patients are using AI to answer clinical questions. So you can imagine that all of these folks are coming together with not quite the same mental model about what these tools are, the strengths, the limitations of those tools. So the goal of our project is to sort of bring all of these folks together to figure out, what do we all need to sort of know or understand? What's the shared mental model that we need to have so that we can ensure that we're actually using these tools safely and effectively? And our team has brought an interprofessional advisory board together to inform the development of interprofessional AI competencies. Pharmacists and psychologists, physicians, MD, DO, folks from different regions around the country, whether it's rural regions, metro regions, large academic institutions, community hospitals. We start by identifying these competencies, and we're hoping that those competencies will lead to other initiatives. For example, our team is going to develop the FACP curriculum, which is the interprofessional curriculum for artificial intelligence augmented teams. And that curriculum will be web-based, and it'll be informed by those competencies that expert interprofessional international advisory board has identified. Not every organization or health system or program is the same, but I'd like to at least develop a foundation that allows folks to build off of. There's something out there that people can sort of turn to as they look to develop their own interprofessional curricula at their institutions or within their organizations. I believe our program or our initiative can certainly can serve as that foundation. Our curriculum alone isn't going to address this problem. A multifaceted approach will be necessary. That means engaging with policymakers and AI developers and other stakeholders that are involved in the development and the integration and the monitoring of these tools as well. Being a Macy faculty scholar has been one of the highlights of my career. There's inspiration that you get to keep pushing forward even when things seem challenging or when things seem especially difficult. Seeing people with the passion and the commitment that they have working on the projects in the way that they do is amazing. It's just been certainly transformative for my career.